Health officials have a message for pediatricians and parents to try to tackle childhood obesity earlier and more aggressively. For the first time in 15 years, the American Academy of Pediatrics released new guidelines for treating the disease. But parents are worried about unintended consequences. One parent in Washington state says she's not just against the new guidelines, they outright scare her. Our sister station in Seattle has the story.
Obese, large, heavy, overweight. We all know the words used to describe what science calls having an excessive amount of body fat.
So medicalized and stigmatizing that to hear those, I hear, oh, that's a medical thing that someone's trying to fix.
Mom of three, Christy Facio says doctors have been trying to fix her with diets since she was 12 years old.
So much shame. It didn't help. My body still did what it was going to do.
She says the dieting only led to eating disorders and mistrust, and there's worry that what happened to her could happen to more kids.
When you believe that your parent thinks you need to be fixed, it's hard.
The new guidelines suggest the long-standing approach of watchful waiting doesn't work, and that doctors should offer anti-obesity medication to treat kids as young as 12 and weight loss surgery for kids as young as 13 who have a body mass index above the 95th percentile, or in other words, who are obese.
So we're starting to medicate and cut into them when they're not developed yet.
I don't think about it as medicine. I think about it as helping families make changes in their child's behavior.
Brian Salins is a professor of pediatrics with the University of Washington School of Medicine and says he wasn't surprised by the update. The rate of childhood obesity, which can lead to type 2 diabetes and high blood pressure, has been on the rise, up nearly 3% between 2008 and 2020, according to the CDC. Brian says it's this data that shows doctors need to be working with families, not against.
Yeah, we need to sort of change environments for healthfulness to prevent obesity, but we also need to do that so kids can be successful and they're trying to make changes in their behaviors.
Professor Salins adds the pediatricians he's talked to say medication isn't a first line of defense. One reason could be it's expensive. The drug Wegovy, which is approved for kids, is $1,300 per package.